London is a metropolitan city full of diverse cultures and communities, but it's also a city of contrast with many different socio-economic challenges. In one London borough, tackling inequalities has become a primary focus. Nick Thatcher went to visit Lambeth Council Public Health to see how they're working with partners and the community to find solutions to improve outcomes of local residents.
Lambeth is a dynamic, vibrant and diverse London borough, but it's also one of the most deprived areas in the country. The council leader here told me tackling what are often deep-rooted social inequalities is one of her top priorities.
Lambeth is a fantastic borough to live and to work. It's got thriving town centres, it's got high rates of employment and it's got really good education. But we do know that in a small borough like ours, a geographically small area, there are still some real fundamental inequalities, and we see that in the health outcomes that people experience. And we know that integral to a successful approach has to be partnership, and that's partnership across the council, partnership with other organisations, and most critically and fundamentally, partnership with our local communities.
Central to this is a health and well-being strategy.
Hi, come on in.
Hi, Doctor.
Dr. Mitra has been a Lambeth GP for more than 20 years and is the chair of the local Staying Healthy board. When it comes to treating conditions like asthma and obesity, he says, the social factors contributing to them also need to be addressed.
I see a lot of problems are intergenerational. I know that when people come to me with these problems, I can't solve them on my own, that I'll need help from other agencies. So in Lambeth, we have a Lambeth Together initiative, where health and social care agencies work together around the person to provide them with the support they need. So, for example, in obesity, they can go to a group, learn about food, have support from other people who have the same condition, learn about exercise, rather than coming to me and having tablets or being referred for an operation.
And we know that inequalities start at birth, and nearly 40% of children leaving primary school in Lambeth are overweight or obese. So Lambeth Early Action Partnership is working in 4 of the most disadvantaged wards in the borough to give children a better start. Known as LEAP for short, it aims to support the social and emotional development in babies and children up to 4 years old, as well as to improve their communication skills, diet and nutrition.
And the very tall giraffe.
Mum Edith Afram volunteered to help with the summer play scheme sponsored by LEAP and found it also made a huge difference to her well-being.
For myself, it was an opportunity to socialise with other parents, to talk about the ups and downs of parenting, and for my children it provided a social as well as a learning experience for them, because they were able to talk to other children, learn how to play, and also having somewhere to go to that was affordable, it was nearby, and just going there knowing that people cared about us, it made a real difference to us this summer.
Different communities can also have particular health challenges. People from black and minority ethnic groups, for example, are diagnosed with long-term illness around 10 years earlier than the white population. And black Caribbean adults are more than 2.5 times as likely to have severe mental illness. And to try to tackle some of these inequalities, Black Thrive has created a partnership between the community and service providers, which aims to improve access to and the experience of mental health services.
With collective impact, we're basically equalising the voice of the statutory services and that of the community, making sure that there is dialogue, that it's open, that it's honest, and most importantly, that it's measured and evaluated. And also public health can look and say working together with the community is actually incredibly positive for the outcomes.
Tackling social inequality and improving health outcomes takes time. There are no quick fixes. But in recognising the challenges that remain and by working in partnership with its communities, Lambeth is committed to ensuring all its residents can share in the benefits of living here.